Welcome to the Week 2 presentation. In this presentation I'm going to talk about the professional orientation of counselors. And a lot of this stuff is taken out of your textbook, but I kind of wanted to go more in depth and see if I could help you make sense of things a little bit better. So first I want to look at counselors versus other professions, and one of you mentioned in the discussion board that you were confused about why counseling is so hard to define, and this is part of the reason, one of the reasons why. Okay, and I'm going to try and touch on that throughout this presentation because it's a really complex issue, and it's one of identity, professional identity. So counselors versus social workers versus psychologists versus psychiatrists. What's the difference between them? So first of all, we have differences in training. And I'm going to see if I can type in here and help explain things a little bit better. So both counseling is at the master's level. So you have to have a master's degree to be a counselor. We do have a PhD in counselor education and supervision, but the practice part of counseling is at the master's level. You can't get a bachelor's degree in counseling. You don't need to get a PhD. If you get the PhD in counselor and supervision, then you're going on to teach counselors, not to practice. Social work, they have the master's degree option, but you can practice with a bachelor's degree and you can be licensed at the bachelor's level. And masters. Psychologists, they have a master's degree, but licensure is at the PhD level only. And then psychiatrists are MDs first, and then they do their residency in psychiatry. Psychiatrists, as of now, are the only ones who can prescribe medication. So that's the big difference in terms of training right there. Differences in philosophy. So counseling focuses on the individual, and we use a wellness model, which I'll talk about in a second. Social work is more at the systemic level. And they focus on social advocacy. We do both of those things in counseling, but we start with the individual first and then go out. We consider social advocacy, and we also consider the system, especially those of you who work in systems, school counselors. We have a lot of that. We always have to consider the family and the impact that the family has on our clients, but we don't work with the family per se. With social work, they're really well versed in the system and how it impacts the individual, and they're always kind of thinking that at the forefront and how they can make a difference too. Okay, and we may consider it, but I remember when I was a school counselor, I would always get frustrated by the fact that I would work with kids at home and then have to send them home to their family. That was really a large part of the problem. Social workers would think, I'm going to go into the home and I'm going to work with the family. Psychologists typically work with the individual first, so they have less of that social advocacy and systemic focus, but they are coming at counseling or at mental health with more of from kind of the medical model, which means that they seek to diagnose and treat. Okay, so we have the diagnostic and statistical manual, and you've heard about the different disorders. Work with clients, work with students who are diagnosed with ADHD or anxiety, and so on. And we certainly use those as counselors, and you'll see in the field that counselors a lot of times will do diagnosing as well, mental health counselors. But in terms of philosophy, we really think that counseling really, in a perfect world, wouldn't use the diagnostic model. We would say that we're going to focus on the individual and on helping them get better. We don't need to diagnose. We don't need to seek out the problem and then fix that problem. diagnose and treat with talk therapy. Psychiatrists use the medical model, obviously, as their medical doctors. They diagnose and treat with medicine. And sometimes talk therapy, but mostly with, as you all know, they mostly are prescribing meds. I think part of this is because there's quite a shortage of psychiatrists right now, especially in this area, and so they really are just having to go from patient to patient, and just simply diagnose medication, then leave it up to psychologists and counselors and social workers to do the talk therapy part. The focus comes from, let me shift all this around. All right, so the focus comes from how and what we treat. So ideally, okay, I'm saying this in a perfect world. Let me put a little line in here, see if I can make it bigger. In a perfect world, there we go, we're going to see psychiatrists working. So if we think about this line as thinking about mental health, with more extreme, we'll put less extreme disorders over here, like developmental issues, and then more extreme over here, like personality disorders. Okay. Make this smaller. Move my little line down here. Okay, so developmental issues being like graduating from high school, going to college, death, grief, and loss, kind of normal life events that are going to cause us stress and anxiety and depression and things like that. Okay, so those types of issues, and then our more extreme, like personality disorders, which would be like antisocial, borderline, schizophrenia. So people who really, there's certainly treatments for those issues, but they're not going anywhere. Okay, it's simply a matter of managing those personality disorders. You're going to see counselors and social workers over here, and then we're going to see our psychiatrists and psychologists over here working on this end of the spectrum. All right, that would be in an ideal world. This doesn't happen though. Okay, and this is part of the reason why we have such a problem differentiating counseling from other fields. And I'll just make a new slide for this. Okay. Why is it hard to differentiate counseling? Okay. In the real world, counselors and social workers and psychologists, not psychiatrists, do the same thing. The same people. Okay, so you'll see if you look at job postings, you'll see that they are seeking someone with a degree in counseling, social work, and a lot of times they'll say, or a related field. Okay, so they're willing to hire anyone who has that license. It's not a bad thing. It's just a fact. If you go into a mental health clinic, you're likely to see a social worker, or a counselor, or sometimes a psychologist. All right, depending on where you go. we all do the same thing and we do it interchangeably. You'll also see that a lot of places where there are fewer psychologists, you'll see counselors and social workers working under the supervision of a psychologist or a psychiatrist. And so the psychologists and psychiatrists don't necessarily do a lot of direct work with clients. Counselors and social workers do that direct work. So you have counselors and social workers working with the more extreme cases. Okay, so if we go back to my little graph here, my little line, counselors and social workers are ideally dealing with the less extreme issues, but they're generally seeing whoever's come into that clinic. Okay, just because of the way it's set up, the way the clinic's set up, because there are just fewer supervising professionals, and counselors and social workers are more available. Another reason why it's an issue is because counseling is used as a broad term for a lot of things. The term counseling. Counseling or counselor. So you've got camp counselors, and you have financial counselors, and you have people calling themselves counselors who don't have the right degree. So the job itself might be as a counselor, but the person who's hired doesn't have the degree, so they call themselves a counselor. And we'll see that a lot, especially in the more eastern areas of Kentucky, because there's just a shortage of people with master's degrees, and so people with a bachelor degree are working in the profession. They just don't have that license, and so that's it's really an identity issue. It's a advocacy issue for us as counselors, because we haven't taken that title like social workers have. You would never call yourself a social worker unless you had a social work degree, and part of that's because social workers are so good at that social advocacy, that means that they're really good at advocating for themselves. Part of it is that counseling is a new field. We're the newest of all of the fields, and so we're still trying to differentiate ourselves professionally from the others. And then part of it, and this is the third reason, is counselors are trained by, and I'm going to do a little formatting here because this is going to drive me nuts. There we go. By psychologists and other professions, and supervised by psychologists and social workers. Okay, so right now, and this is a huge issue in our field. Counselors are not purely trained by counselor educators. So people who are professors in counseling programs have degrees in other areas like psychology, like sociology, just anyone who's worked in the profession. Which on the one hand, it gives us makes our profession really diverse, gives us a lot of different perspectives. But on the other hand, it makes for an identity issue. Because if you're being trained by a psychologist, you're learning from the field of psychology. Essentially, you're learning from someone who is trained in that field, not in the counseling field. And then counselors are being supervised by people who are not just counselors. They're psychologists, they're social workers, and so on. And so it can lead to some confusion when it comes time to identify and define who we are. If you don't know who you are, then how can you tell someone else. If you've never been taught by someone who's a counselor or educator, if you've only been taught by people who are psychologists or social workers, then you're going to identify more with their field. If we think to school counseling specifically, so school counseling is right now an offshoot of counseling. But with school counseling, there's, one kind of camp of school counselors who think that you should be teachers first. And in Kentucky, it's really, a relatively new thing that you don't have to be a teacher first. And I know some of you in this class, and some of you for sure, or some of my practicum students for sure are worried about this because they weren't teachers beforehand, and they've heard that, some principals and the hiring people in schools prefer that, and they likely do because, again, this is kind of a new thing for the state of Kentucky, that you don't have to be a teacher first. So there's that camp that school counseling is really more of an educator role, and then the other point of view is that school counselors are counselors. Okay, so what is a school counselor? Are we educators or are we counselors? Are we coming from a teaching background? And do we have to have that teaching background to be effective counselors? Or is the training that we need, the training that we're getting in the counseling program, is that enough? Okay, so that's kind of a debate too. Which makes it, again, an identity issue. And it makes for, it's an identity issue in the school, especially if you're the only school counselor or you're one of the only school counselors. You're always, kind of on your own in a school system, because most times your principal, unless you're lucky enough to have a principal who was a school counselor, they don't know what a school counselor does. Okay, so your principal doesn't know what a school counselor does. Teachers don't know what a school counselor does. The only people who know what a school counselor does or should do is you. And if your principal doesn't know what a school counselor is supposed to do and doesn't use a school counselor appropriately, then they're giving you a lot of other stuff. That's where a lot of those administrative duties are coming in. And, a lot of places right now are hiring on social workers, school social workers, who are doing things that school counselors should do. And so school counselors are then taking on even more of an administrative role. So it's a huge issue, and it's one that we need to work on, and we can work on that. And hold on, I'm going to pause this and find an article that a former student just... Okay, here we go. So there's been a recent act passed, or drafted. So the House and Senate Conference has drafted a bipartisan bill that Every Student Succeeds Act to replace No Child Left Behind. ASCA has worked diligently to preserve many of the school counseling provisions. The bulk of school counseling provisions and opportunities for funding are found in Title IV, Part A, Student Support and Academic Enrichment Grants. The purpose of Title IV is to increase the capacity of states, school districts, schools, and communities to provide all students with access to well-rounded education, improve school conditions for student learning. This section has several school counseling provisions. And to improve the use of technology to improve the academic achievement and digital literacy of all students. Now be formula funded, much like Title I, which would give schools funding. So before, funding was allowing these competitive grants were allowing school counselors or school principals money to bring in outside people like the school social workers to work with students. The new wording of the law is going to allow for hiring on school counselors. This plan will now include explicit language around comprehensive school counseling services, professional developments for school counseling, and career counseling services, and so on. And we got this in there by advocating. So ASCA, and I know one of my friends, one of my close friends, is a school counselor in Memphis, Tennessee, and she is a huge activist active member of ASCA, and she has been to Washington, D.C., and she's been lobbying at Washington, D.C., working on some of these things so that we can get school counselors in the schools. So it's not something that we just talk about, it's something that people actually do. All right. Next, so the wellness model. So this is one of the things that sets counselors apart from the other fields, and this is a way of life oriented toward health and well-being, and it says that mind, body, and spirit are integrated fully. And so we come at counseling from the wellness model, where we say that, where we look at people as a whole, okay? So let me see if I can open this. Here we go. Maybe. Alright, I'm already at 20 minutes with this presentation. I'll try and wrap this up. Trying to keep it under 30. This is something that I'm really passionate about, though, so I can ramble. Is this working? There we go. So here's what the wellness model looks like. And Myers and Sweeney were the ones who developed this. So there's 6 dimensions of wellness: spiritual, emotional, occupational, physical, social, intellectual. And so we say that the person is composed of these different areas, and this is how we assess what's going on in a person's life and work with them within each of these areas to improve their life. So we seek to help people get balance in their lives and maintain balance, and we come at this from the individual level, but also consider all of these things. So social is one piece of the person, right? So unlike social work, which has more of that systemic approach, we consider the social as one piece of the person. And we don't have that tendency to diagnose unless we have to. And so there are, I found an assessment based on these 6 dimensions. So I'll post the link to that for you guys. This is a really great tool to use whenever you're working with people, because it helps you hone in on what's going on with that person. A lot of times you'll have someone come in and they have, a lot of times the emotions or the behaviors, especially with kids, the behaviors are kind of the symptoms, but they're symptoms of something else going on. And if you have kind of a comprehensive assessment where you're asking them questions and looking at all these different areas, you can really see what's going on. It may be, in the case especially of kids, it may be something going on in the classroom that's causing them to act out, and maybe they don't understand, what's going on. Maybe they aren't able to keep up with their homework. Because there's something going on at home. So there's something going on at home. So there's something going on in the social side of their life that's causing problems with their class, which is then causing emotional problems and behavioral problems. So there's that. And I'll post some resources for you regarding the wellness model. But I'm not going to spend a whole lot of time on it, because I've already talked too much. Okay. Professional organizations. ACA is the world's largest association for counselors. It is divided into 2 subcategories. It has 19 divisions divided into 2 subcategories, recognized by being either passion, work settings, and also has 4 regions. So one of the divisions is, back down, here we go, is the ASCA, the American School Counseling Association. So it's actually a division of the American Counseling Association. So professional organizations and codes of ethics. So we've got ACA and we've got ASCA. We're going to focus on, and the textbook focuses on the ACA Code of Ethics. ASCA is going to be more specific to schools, so if you're a school counselor, we will also review the ASCA Code of Ethics. If I remember correctly, it's been a year since I've taught this class, but I'm pretty sure that ACA Code of Ethics is just more comprehensive than ASCA, and there's probably a few points in the ASCA Code of Ethics that are specific to schools, but it's a lot shorter than the ACA Code of Ethics. So ACA is going to be the more in-depth option, which is why we're going to focus on it. And then NBCC, the National Board for Certified Counselors, has a Code of Ethics as well. You don't have to follow this unless you are a National Board Certified Counselor, which is something I'm going to talk about in just a second. Now, we're focusing on ACA back up here. We're focusing on ACA in this class. That doesn't mean you're not responsible for making sure you uphold the ASCA Code of Standards. So we are going to look at it, like I said, but likely there's not going to be any discrepancies between the two. Now, if you have an ethical dilemma, and so if you look at those ethical decision-making models, one of the steps in resolving an ethical issue is to consult the codes of ethics. So you'll want to look at, the ACA Code of Ethics or the ASCA Code of Ethics, whichever you refer to first, and see if it addresses your particular dilemma. If it doesn't, then you go to the other code. Okay, so if you look at ASCA first, ASCA doesn't say anything about your issue, then you jump over to ACA and see if they say anything about it to kind of help you make your decision. Okay. Now, other professional organizations, so NBCC. I don't know why I even have this slide here. I'm just going to take it out. Okay. We're going to jump down here. Licensure portability. Okay, so licensure versus certification. Licensure is, we'll just rename this slide. Licensure versus certification. All right, licensure is at the state level. Sorry, I'm typing this as we go. This is just kind of how I think. I like writing on the board and stuff when I'm in the classroom. So this is my version of writing on the board. All right, licensure is at the state level. Okay, this is true for licensed professional counselors. So those are our mental health counselors. This is true for licensed professional school counselors. It is at the state level. So Kentucky is responsible for licensure for counselors, school counselors. Ohio has different standards. Tennessee has different standards. West Virginia has different standards. A lot of them are similar, but we don't have any national standards for licensure for counseling right now. Certification, however, NBCC provides national certification for us, okay? So this is another part of the counseling identity drama that's going on right now. We are trying to provide portability. So I'm not really doing anything with it, but people out there are, who are advocating for us, are trying to get us to, what that means is that you can go from Kentucky and it will be easy for you to, let's say you move from Kentucky to Florida, where it is warm right now. I'm recording this in the middle of our, snowstorm. We've already got a foot of snow. So Florida's where we all want to be right now. If you move to Florida, you could easily get licensed in the state of Florida. You wouldn't have to do anything else. You wouldn't have to do more supervision hours, take any more classes, nothing. This is what would be ideal if that were an option. NBCC, the National Board of Certified Counselors, is giving us a national certification that's saying it's not licensure, but it's basically letters that you can put after your name. But it says that you've taken a National Board Certified exam, you've passed it, and you've graduated from an accredited counseling program, so you are a certified counselor. Okay. Yep, that's what we're trying to do. we're pushing for portability. NBCC is kind of giving that option to you right now. Now, some states require you to take the National Board Certified Counselor exam. So there's if you go to NBCC. Exams, understanding certification. Here we go. They've got a little thing here. Demonstrates that the counselor has met national standards set by the counseling profession. License is permission from a state to practice in that state. So you can go here and learn more about it, and I'll post a link to this on Blackboard. And then there are exams. Some states require for their licensure for you to take this exam from the NBCC. Some other states require different exams. Some states require no exams. It just varies. So that's certification versus licensure. What am I doing? Here we go. The NCE is, and it's something you can take, and they've got, pretty sure, they've got a master's, National Certified School Counselor exam too. So you can become a National Certified School Counselor, which would be an additional credential for you. And that's it. The NCE, the basic exam, is a 200-item knowledge test. You could also take and just become a National Certified Counselor if you choose. It's used to assess individual performance of voluntary participation in specific domains. Those domains are the same across counseling programs, so they're all from classes you've taken. They also have, so back up to the codes of ethics, if you become an NBC, C, a National Certified Counselor, NCC, then you have to follow their code of ethics. If you don't have to follow their code of ethics, though I don't think, I am quite sure that there's nothing different in here than is in the ACA code of ethics. All right. I don't know if that cleared anything up for you, but it's all I got for today. So, stay warm, and I will talk to you next week.